Good morning, I'm Joe Fryer.
And I'm Savannah Sellers. Right now on Morning News Now, Delta dominating the highly contagious COVID variant is now making up more than 80% of new cases nationwide, as more hospitals report a surge in unvaccinated patients, threatening to overwhelm them. This morning, another new trend one ICU is now noticing among those fighting COVID. Let the games begin. New concerns this morning about the spread of COVID as Olympic events get underway in Tokyo and more athletes test positive, including another member of Team USA. Could the Olympics still be canceled if the outbreak gets worse? We have the latest concerns from athletes and organizers. Under arrest, a close friend of former President Trump who chaired his inaugural committee is now facing federal charges, accused of illegally lobbying Trump for years on behalf of the United Arab Emirates and then allegedly lying to investigators about it. What prosecutors are revealing about this Trump ally and the potential fallout this morning. And ending the drought, the Milwaukee Bucks are NBA champions for the first time in 50 years. The moments that led up to this historic win and the young rising superstar who dominated the court during the series. Very exciting for them.
You get to be tested on his name later in the show?
Yeah, that is true. That is something coming up for me. I worked on it, so hopefully I land it.
You really just need the first name.
Yeah.
That's everyone knows.
Everybody knows it. Exactly. He's doing so well. All right, we'll get to that in a little bit. We begin, though, this morning with clear signs of a setback in the fight against the coronavirus.
The CDC says the fast-spreading Delta variant now makes up 83% of all COVID-19 cases across the U.S. That's up from 50% during the first week of July. Coronavirus deaths are also up nearly 50% compared to last week. The CDC says the average of 239 Americans are dying from the virus each day. CDC Director Rochelle Walensky told Congress yesterday most of those deaths did not need to happen.
Each death is tragic and even more heartbreaking when we know that the majority of these deaths could be prevented with a simple, safe, available vaccine.
We've got it all covered for you this morning. Dr. Bernard Ashby is standing by in hard-hit Florida to break down what you need to know as the Delta variant spreads. First, let's get a closer look at the challenges that one hospital is facing. NBC News correspondent Ellison Barber is at the Lexington Medical Center in West Columbia, South Carolina, where hospitalizations are back up. Nearly every COVID patient there is unvaccinated. Ellison, I know you were at this hospital before around this time last year. So tell us, what's the situation like now and how does it compare with what you saw a year ago?
Yeah, I mean, it's been almost exactly 1 year since we went into the designated COVID ICU ward they had at this hospital. They officially closed that designated ward in mid-March, but now they're having conversations about whether or not they need to reopen it because they saw the number of ICU, intensive care COVID patients, jump from 0 to 8 in just 1 week. When we were there yesterday, there were 9 COVID patients in ICU. One of the patients was brought while we were there on the floor. The vast majority of them unvaccinated. The biggest outward noticeable difference was the ages in these patients. When I was in the COVID ICU ward last year, most of the patients that I saw were older, in their 70s and their 80s. The youngest one on the floor at the time was a fairly young grandmother, but in her late 50s, early 60s. Yesterday, when we walked onto that floor and we saw the COVID patients, one of the first things I noticed in 3 different rooms was that they all looked like they could have been about my age. The first patient we saw who was intubated, sedated, receiving a plasma exchange treatment was just 26 years old. Across the hall from him was someone in their early 40s. Next to that person was someone in their late 30s. Doctors are worried that if something does not change, they could be headed right back to where they were this time last year. Listen to what one of the ICU doctors told us.
And that I think we've seen how bad this can be. We've seen the effect on people and families. We've seen the effect on the community in every way. And it's, and none of us want to get back there.
And they have about 20 COVID patients at this hospital as of yesterday. We're told all but 3 of them are unvaccinated. But doctors say the ones who are unvaccinated tend to have other conditions, other comorbidities that ultimately led them to need hospitalization in addition to having COVID-19. One of the key things doctors say they are noticing among the younger unvaccinated patients is that they largely don't have any pre-existing conditions. Some are considered medically overweight, but other than that, there's nothing else indicative in their health history that would make them be at a higher risk of getting a severe case of COVID-19.
So,
Joe?
Ellison, focusing on the unvaccinated, I know you spoke to one patient who was in that hospital for 2 months. What did he tell you?
Yeah, he spent 2 months in the ICU, 2 months in the hospital, rather, a couple weeks in the ICU, and he was sedated, intubated on a ventilator. He told us that his family was told to go ahead and start considering funeral arrangements and plans because they were not sure and at one point really didn't think that he would survive. He was not vaccinated, even though he was eligible to be vaccinated much earlier in the year. He said that at the time, he just didn't feel like he knew enough about the vaccine. He thought it was too new and wasn't sure if it was risky. He decided he didn't want to get it. He says that it is a decision he now deeply regrets, and he will tell anyone who will listen he wishes he'd gotten vaccinated. Listen here.
I would tell them, like, yeah, go ahead and get the vaccination, because the COVID is for real. Like, it had me on my dying bed, and I didn't know whether I was going to make it back or not.
He spread the virus to his mother when he got sick in April. He said his mom had already had 1 dose of a COVID-19 vaccine, Moderna, and she was not nearly as sick as him. He thinks it's because she'd already had 1 dose where he had not had any. Joe.
Ellison Barber with a return trip to a hospital, one we were hoping he wouldn't have to make. Ellison, thank you.
New research from the CDC shows just how devastating COVID-19 has been. The data shows life expectancy in the U.S. dropped by 1.5 years in 2020. That's the largest decline seen in a single year since World War II. I want to bring in Dr. Bernard Ashby, a cardiologist based out of Miami. Doctor, good morning. Thank you for being with us. Let's start with the situation nationwide right now. New COVID-19 cases, hospitalizations, deaths, all those metrics are back up because of this highly transmissible Delta variant. Is this a resurgence? Is this a fourth wave? How worried are you about where the country might be headed and what this means? Is this lockdown again? What do you think?
Well, good morning, and it's a pleasure to be here, and it's a pleasure to speak on behalf of other medical professionals in my community. So basically, what we're dealing with is a new variant that, in a lot of ways, is more transmissible, and the exact mechanism is related to the fact that it has a shorter incubation period, and it has a much higher viral load. In fact, it's at its peak, it's 1,000 times higher, the viral load, than the previous variants that we've dealt with. And we've seen in India where this Delta variant has ravaged that country, and around the world where it's ravaging other countries, including Thailand, including some countries in South America, and it's predictably doing the same here. But the difference is that we have a much higher degree of immunity, whether it be through the vaccines or through prior infection, that we won't see the same peak levels that we saw, earlier in the pandemic.
Well, that's a little bit of good news there then. Now let's talk about your state, Dr. Florida. That's where 20% of the country's new coronavirus cases are coming from, according to White House officials. What can you tell us about what you're seeing firsthand happening in your state and who's most at risk there right now?
So it's very interesting. Florida kind of has the inverse relationship to the rest of the country, mainly the Northeast and the other colder climates, with regards to when and how we surge. So during the summer, that's really our winter equivalent, where a lot of folks are indoors because it's so hot and humid outside. And as a result, that behavior increases your risk of getting the virus. And it's quite evident that the vaccines are very effective. And what we're seeing is that the infection rates are highest, and the death rates and hospitalization rates are the highest in those who are unvaccinated with no immunity whatsoever. And unfortunately, it's disproportionately impacting communities of color, low SES communities, especially communities where they tend to cohabitate and have multi-generational homes. So this is it's actually having a desperate impact on certain demographics, particularly in Florida. And our governor, unfortunately, has not taken the proactive steps to deal with this, and unfortunately has remained in a reactive posture, much to the detriment of our population.
Dr. Bernard Ashby, thank you so much for joining us this morning.
Thanks for having me.
COVID is hitting Team USA again. Another American athlete tested positive for coronavirus this morning. It's U.S. men's volleyball player Taylor Crabb. He's joined the growing list of Olympians contracting the virus. The 29-year-old Olympian from Hawaii was scheduled to play his first match Sunday against a team from Italy. NBC News Now correspondent Isa Gutierrez joins us now with more. So, Isa, Taylor Crabb plays beach volleyball. A reminder to folks, that's a two-person team. What does this mean for his Olympic dreams, and how about the dreams of his partner?
Yeah, Joe, Taylor was expected to play his very first game on Sunday against Italy with his partner. Of course, now that he's tested positive for COVID-19, he's in isolation away from the rest of his teammates. This means that he likely will not be able to play in the games. And another player, Tri Bourne, who's a former standout from USC, just arrived in Tokyo today. He's expected to replace him and play with his partner this weekend and for the remainder of the games. Meanwhile, Taylor's brother, who's also a professional volleyball player, said that this is just a terrible situation for him. He also said that in his personal opinion, his brother, even though he has tested positive for COVID-19, should still be allowed to play and is, quote, fine and healthy. Joe?
Yeah, something tells me that is probably not going to happen, at least anytime soon. So how are these new positive cases affecting other athletes on Team USA? They have been training for years. They've had to wait an extra year. I'm betting they just want to start competing as soon as possible. What are they saying?
Yeah, we've heard from athletes that this is just really a terrifying situation for many of them. For example, third-time Olympian April Ross, she's a beach volleyball star. She's saying that this time around, these cases are really a huge topic of conversation among the athletes. Take a listen to what she said.
When another case, is kind of comes up or found out, it's like, oh my gosh, did you hear this person, that person? And it's really heartbreaking every time you hear that, and actually pretty shocking because of all the precautions we had to take before we left and what's on the line. And I know everyone I know was really careful. And so it's kind of like, then this person was vaccinated and they still got it. And it's just shocking and it's scary.
April said that this has made her realize that these athletes have to be really careful, even though they are vaccinated, especially in a place like the Olympic Village, where there are many crowds, she says, thousands of other athletes from around the world. She also said that she feels that on the ground, protocols aren't really being enforced very much, such as mask wearing and social distancing. So she feels like it's really up to her and the other athletes to really protect themselves. Joe?
No doubt they're taking this seriously. So, Isa, the Olympics opening ceremony is the day after tomorrow on Friday. I understand even now questions still swirl around the future of the games, even though some competition has already started.
That's right. Yeah. So the Tokyo Olympics president was asked directly yesterday whether these rising infections would impact the games, if they would be delayed or if they would be even canceled down the line. Potentially, he did not give a definitive answer on that, other than saying that they would just keep a close eye on these COVID-19 cases. But like you said, the games have really already begun, even though the opening ceremonies haven't happened yet. Team USA already won their first game, bringing home their first victory. The women's softball team played against Italy today, and we're expecting to see more games that are scheduled over the next couple of days as well. So the show's going on for now. Joe?
And Team USA off to a good start on the softball field. All right, Isa Gutierrez, thanks so much.
All right, sparks were flying on Capitol Hill yesterday as Kentucky Senator Rand Paul and Dr. Anthony Fauci faced off yet again during a coronavirus hearing. This time, the senator outright accused Dr. Fauci of lying. Take a listen.
Dr. Fauci, knowing that it is a crime to lie to Congress, do you wish to retract your statement of May 11th where you claimed that the NIH never funded gain-of-function research in Wuhan?
Senator Paul, I have never lied before the Congress, and I do not retract that statement.
All right, let's bring in NBC News Capitol Hill correspondent Leanne Caldwell, who can tell us a little bit more about those sparks that were flying. This isn't the first time these two have clashed on the Hill, but it did get pretty intense. Can you tell us more about what happened and why?
Good morning, Savannah. You're right. It's not the first time the two have clashed. They've clashed over the origin of coronavirus. They've clashed over mask wearing. But yesterday was probably the worst. Now, Senator Paul was charging Dr. Fauci and the NIH over funding what is called gain of function studies. And that's a controversial way to make viruses more potent, to study how they are spread and how to treat them. Now, Dr. Fauci denies that the NIH ever did this. And let's listen to more of what happened yesterday.
This paper that you were referring to was judged by qualified staff up and down the chain as not being gain of function.
So
let me finish.
You take an animal virus and you increase its transmissibility to humans. Right. You're saying that's not gain of function?
Yeah, that is correct. And Senator Paul, you do not know what you are talking about, quite frankly. And I want to say that officially. You do not know what you are talking about. And you are implying that what we did was responsible for the deaths of individual. I totally resent that. And if anybody is lying here, Senator, it is you.
So a really intense exchange between the two. Of course, there are questions about the origin of coronavirus. It's something that conservatives, especially people like Senator Rand Paul, have really been honing into. And we saw that manifest yesterday in that exchange, Savannah.
Yes, we most certainly did. All right, Leanne, let's stay on COVID and the Hill. There's been a development in the case of those Republican lawmakers who refused to wear masks on the House floor when it was required. What's the latest development there?
Well, they were fined $500 at the time, which is what the punishment was that was instituted at the time. And these lawmakers appealed and they lost that appeal. And so the point is there's still lots of battles up here on Capitol Hill over coronavirus, but we are seeing some Republicans, not the three that you just saw on the screen, like Marjorie Taylor Greene, but others who are really starting to push people and their voters and their constituents to get vaccinated. We heard that from Senate Minority Leader Mitch McConnell yesterday, even GOP whip Steve Scalise from Louisiana.
All right. And Leanne, finally, before I let you go, we think it might finally be Infrastructure Day. We'll see how this all plays out today. But Senator Majority Leader Chuck Schumer is pushing for that procedural vote today to get infrastructure legislation moving. This was his Wednesday deadline. He's trying to stick to it. Republicans say, though, that Democrats are accelerating the process before it's ready as these negotiations still play out. What happens if this vote fails?
That is the question that Democrats who are in control of the Senate are not letting on to. They are insisting that Republicans should vote to start this process. This group of 22 negotiators on this bipartisan infrastructure bill worked late into the night. They are making progress, but they still don't have this legislative text. So we're going to see if Republicans decide to block this, and if so, how Democrats respond. Savannah.
All right, Leanne Caldwell, we'll be checking in with you on that. Thank you so much.
Yeah.
Former President Trump's inaugural committee chair is facing federal charges, accused of acting as an agent for a foreign country. 74-year-old Tom Barrack, a longtime friend of Mr. Trump, is accused of working on behalf of the UAE, the United Arab Emirates, and lying about it to federal agents. NBC News correspondent for investigations, Tom Winter, joins us now. Tom, first of all, just lay it out for us. Explain what charges is Barrack facing?
Well, it's a whole host of different charges, but it really centers around two specific areas. One, that he failed to register as a foreign agent working on behalf of the United Arab Emirates. And then the second is that he lied to the FBI in several different ways. Basically, what they're saying here, Joe, is that from April 2016 to April 2018, so both while Trump was a candidate as well as once he was in office, that Tom Barrack essentially acted as an agent of the United Arab Emirates. How did he do that? A couple of samples of of that include editing a speech that the president gave to be more favorable to the UAE, op-eds that Tom Barrack participated in, interviews that he participated in, and as well, and perhaps most important here is that he passed along information, sensitive, non-public information about what other Trump administration officials were thinking or what they believed as it related to the Middle East and to UAE. So some pretty significant allegations here. Barrack has denied that he's done this. He says that he's going to plead not guilty, and he says that he's spoken with investigators in the past, Joe.
You know, Barrack has been friends with the former President Trump for years. I think we heard about his influence, especially during the 2016 campaign, saw more as the inauguration approach. But what sorts of ways is he accused of actually trying to influence the former president?
You know, I think when you look at the charges here, the idea that he was involved with editing a speech and involved in speech writing, I think is, you want to talk about foreign influence. I mean, this is one of the most brazen efforts that we've seen in a very, very long time when you have somebody that can get in the president's ear. On top of that, they talk about that there was a meeting in a summit potentially at Camp David involving several new Middle Eastern countries, and that after Tom Barrack called the White House, that meeting was canceled. So, yeah, those are pretty significant efforts.
And Tom, as you mentioned, Barrack's lawyer says he does plan to plead not guilty. But if he is convicted, what kind of penalty could he face?
You know, typically for a Barrack charge or for lying to a federal agent, they're not particularly stiff penalties here. It says up to 5 years. Nobody's ever been given up to 5 years in prison for this type of thing. But he does face jail time. Jail time has been handed out in the past in some of the cases brought by Special Counsel Robert Mueller. So it's certainly not out of the question here that he does face jail time, which is where he is today, Joe, who's still behind bars awaiting a bail hearing.
All right. Tom Winter. Tom, thanks so much.
Sure thing.
It is time now for a check on your morning news now weather, which means Bill Cairns is with us. Hey, Bill.
Hey, good morning. How about that smoke and haze yesterday, guys?
I know.
It was it was one of those rare events where the East Coast even gets it. And, the smoke traveled all the way from Western Canada, British Columbia, where they have a state of emergency in effect, by the way, because of the wildfires. Some of the smoke was from Northern California and that bootleg fire in Oregon. And it just made for an eerie scene. I mean, I could smell it outside my house. It was one thing to kind of see it, but to actually smell it in the air, it was just incredible. And they say it was the worst air quality in New York City in 8 to 14 years. That's how many particulates were in the air. So this is what it looked like. The clouds are shown in the bright white down around South Carolina, North Carolina, and then that hazy stuff out through the Ohio Valley in the Northeast, that was actually the smoke that was showing up on satellite. So pretty incredible stuff. So we have a pretty quiet start to the morning in the Northeast right now. We had some pretty good thunderstorms last night around Binghamton and around Albany, but that cold front is still there. So as we get the heating of the day going, it'll spark up new storms, probably a little early, around 1 to 2 p.m., I'm guessing, is when the storms will fire up. Then they'll slide through Boston, Hartford, Providence, New York City, Long Island, all the way down the Jersey Shore, including Philadelphia, and then they'll pass off the coast pretty early. So 37 million people at risk. Damaging wind and large hail with the storms today are possible. I don't think we're going to see too many tornadoes. Here's kind of the timing of it. Not a lot of showers out there early. There you see around 2 p.m. some pretty good-sized thunderstorms there in Connecticut, New York City area, the Jersey coastal locations, and just south of Washington, D.C. The good news for this is you have afternoon and evening plans. By about 6 to 8 p.m., it's gone through all of the Northeast. The rest of the country, hit and miss showers and storms in the Southeast. Still pretty hot in the West, especially in the northern plains. And tomorrow, we should see a couple 100s once again in Montana and in areas of the Dakotas. So we'll talk more next hour about the fires that produced that incredible smoke and what the status that they are. And I don't know if you saw this yesterday, but people are saying and reporting some of these fires are creating their own weather. I'll let you know if that's a myth or maybe that's true coming up.
I did see that, and we love when you give us a tease, Bill. But yeah, wow, this wildfire season already, it's not good. Thanks so much, Bill. We'll see you in a little bit.
Yes. Okay.
Coming up, the White House is facing mounting pressure this morning to respond to the crisis in Cuba. And as authorities there crack down on protests, many Cubans are fleeing their country, headed for the U.S. A closer look at that perilous journey up next. This morning, the Biden administration is under pressure to handle the crisis in Cuba. House lawmakers met yesterday to address the recent Cuban protests, pushing for action, but they're divided on what to do. Several Republicans slammed the White House response to the protests, calling it a slap in the face. But Democrats defended the ongoing embargo, arguing the policy is popular among Cuban Americans. But Florida Senator Marco Rubio, who represents many Cuban Americans, slammed the administration, saying Congress should respect the wishes of Cubans.
They wanted liberty. Libertad. That's what they wanted. That's what they're telling us. Why don't we listen to them? They told us what they want. They want libertad. They want liberty. And if there are any people on this earth that should understand that, it should be Americans.
The hearings come following that brutal crackdown on Cuban protesters last week. Hundreds are facing charges, and advocates fear they may be convicted without due process. There's also now concern that Cubans will try to flee to the United States by boat, risking their lives in the process. NBC News correspondent Carrie Sanders joins us now from Lauderdale by the Sea, Florida. Carrie, I know you actually rode along with the Coast Guard in search of those Cubans fleeing their country, trying to make it to the U.S. What did you see? What more can you tell us?
Well, good morning, Savannah. Look, for decades, Cubans have been able to flee their country on boats, on rafts, and washing up on beaches like this here in Florida. Understand, there are more than 100,000 applications in Cuba to the U.S. Embassy for asylum, but that is a backlog. And with the most recent protests now, the U.S. government is nervous that Cubans on the island may decide to flee by any means necessary. The U.S. Coast Guard headed on patrol over the Florida Straits towards Cuba.
Checks, flaps up.
Commanding the flight today, pilot Lieutenant Commander Joshua Harrington.
So our primary mission is to save lives, so that's what we're mainly focused with. But enforcing laws of the United States and saving lives are top two priorities. In terms of enforcing laws, that means illegal immigration. Correct.
The crew on this HC-144 on newly stepped-up patrols after violence erupted in Haiti when that country's president was assassinated earlier this month. While in Cuba, just a week later, protesters took to the streets, the largest challenge to that island's communist government in more than 30 years. Protesters demanding liberty, freedom. Haiti, an 800-mile sail from Florida. Cuba, at its closest, only a 90-mile float to Key West in the fast-moving Gulf Stream. The U.S. Coast Guard now on a heightened state of alert, aware when there are problems in Cuba, they can fast become a crisis for the United States. In 1980 and again in 1994, the Cuban government released pressure on its problems, allowing Cubans to flee the island. More than 100,000 took to the seas. The flotilla of immigrants overwhelmed Florida. Before President Barack Obama normalized relations with Cuba, any Cuban national who made it to the U.S. was allowed to stay. But under current U.S. policy, Cubans interdicted at sea are repatriated.
Nobody coming from the sea is staying in the United States. They will be returned to their country. If they have a credible fear, then other arrangements will be made.
As the mayor of this city, what do you do if thousands begin arriving by boat?
Well, we will do what we've always done. You know, we've always taken people in.
In Miami, Cuban Americans, in solidarity with those who protested on the island, say they're hopeful. After 62 years of communist rule, the anger on the island will now lead to change. But many worry if President Biden were to soften the U.S. embargo on Cuba or allow a mass migration, it would only help Cuba's regime. Ninoska Perez came to the U.S. from Cuba when she was 8 years old.
The rafters crisis is what Cuba uses as to get the pressure off. That's what they do all the time. They did it with Mariel. They did it in 1994. That's not what the Cuban people want. Not everybody can get on a raft. The people that are on the streets in Cuba want freedom. It's not about high prices. It's not about lack of medicine or food. It's freedom.
Back over the Florida Straits, no signs of any rafters, but there is growing anticipation. The U.S. needs to be at the ready to spot those who may not want to be spotted if they're just going to be sent back to Cuba. you're there to save lives, but they're playing a little game of cat and mouse.
Correct. They are, because half the time we try to find them, we try to get them safe, but they don't want to cooperate.
In the last 9 months, the U.S. Coast Guard has interdicted 554 Cubans at sea. Compare that to the 12 months before, where they only found 49 Cubans. So there's already been a big increase. And of course, all of those numbers on that increase happened before the protests began in Cuba. Savannah?
Carrie Sanders, incredible reporting. Really just such an amazing look there. Thank you so much. Let's now look at what else is making news around the world this morning. Ali Arouzi joins us from London today. Hi there. Good morning.
Good morning, Savannah, from a very sunny Buckingham Palace. Well, at least 12 people have been killed in central China after devastating floods raged through the Hunan province. Video shows subway passengers trapped in trains flooded with muddy water, waiting to be rescued, while streets were transformed into rivers that carried cars away. The scale of the flooding has been so large that it's forced more than 100,000 people to flee safer ground. Here in England, people celebrated Freedom Day on Monday, which saw pretty much all COVID restrictions lifted. However, the country is still struggling to contain the virus. The UK has recorded over 46,500 new COVID cases and 96 coronavirus-related deaths in 24 hours. That's the highest number of fatalities since March. The Prime Minister has said that he doesn't want to reverse his decision to lift restrictions, but if cases and deaths continue to rise, he may have to make an embarrassing U-turn. Australian show jumper Jamie Kerman has thrown his Olympic hopes into doubt after testing positive for cocaine. He was due to make his first Olympic appearance, but was suspended from the competition after he returned a positive sample for cocaine. His fate hangs in the balance as the Australian Olympic Team Selection Committee decide what to do later, but also some good news for Australia. In the absence of a rival bidder, Brisbane has been awarded the 2032 Olympic Games. Savannah?
I know. I can't believe there wasn't a rival bid, but that's very exciting for them. And yes, it looks like an absolutely gorgeous day in London. I hope you get to enjoy it a little bit. Ali, thank you so much. Coming up, the Biden administration is reportedly rethinking its plan to lift COVID restrictions at the southern border. What the move could mean for the hundreds of thousands of migrants seeking asylum up next. It took half a century, but the Milwaukee Bucks are now NBA champs. This is their first NBA championship since 1971, defeating the Phoenix Suns last night in Game 6. Two-time MVP Giannis Antetokounmpo was dominant, scoring 50 points, tying the record for the most ever in a finals closeout game. Very, very exciting for them and for Giannis. All right, now President Biden was aiming to cancel a Trump-era COVID-19 order that blocked migrants from seeking asylum by the end of this month. But according to three sources familiar with deliberations, the administration is now rethinking that plan. NBC News Justice correspondent Julia Ainsley joins us now. Julia, good morning. So Title 42, as this policy is called, was originally introduced back in March of 2020. Of course, the month we all remember the world shut down. What did critics say about this plan back then?
Well, then a lot of people said, look, there was a lot shutting down. The border would be part of it. Now that conversation has shifted. And I will say even then people thought that maybe Trump was using the cover of COVID to try to stop immigration, which was really one of his bigger plans, to try to stop immigration coming across the borders. Now the conversation has shifted even more, where people who are not only suing the government, but also definitely advocacy groups who have written to the government have said this is no longer an effective strategy at curbing COVID-19. And if you are going to use this to curb COVID-19, you need to have some kind of benchmark. Do you need to wait until rates are at a certain level or vaccine rates are at a certain level? What is it you're trying to get to before you lift this very egregious, or what they would say draconian, measure at the border?
So President Biden has come under pressure, as we know, to cancel this order. But now, as I said, he's rethinking this plan, potentially holding back. Walk us through the thinking there.
Yeah, so we understood that as of July 31st, that had been the date that inside the government they were targeting as a date to lift these restrictions, to start letting at least families come in. Right now, only unaccompanied children are allowed to be the exception to this rule. Otherwise, there's no guarantee, even if you have a very legitimate asylum claim, that you'd be able to make that claim in the United States. So they were supposed to lift this for families by July 31st, but according to three sources, not only have they decided that that is now in flux, they have not even sent plans to Border Patrol to tell them how to put something like that into work. So now that we're 10 days away from July 31st, you would imagine that if they had planned to lift this is a huge order. I mean, there were 750,000 people kept out by this order. If they had plans to start lifting that, we would have already seen those memos, those plans go out. So right now it seems to be on hold.
All right, Julia, then that means we have something to watch for, and we will continue to follow your reporting. Thank you so much. Now it is time for one of our favorite segments, your weekly checkup. NBC News senior medical contributor Dr. Natalie Azar joins us now to discuss the latest health headlines that you may have missed but still need to know. Good morning, Dr. Azar. Always great to have you. So this first one affects a lot of us because I think most of us, at least I hope most of us, and not just me, like to snack, grab for those chips, those types of things. But a new study shines a light on why we should avoid ultra-processed foods. Why should we put down those snacks, and tell us what exactly qualifies as ultra-processed?
Exactly. Well, Savannah, the Western diet gets a really bad rap, and for good reason, right? We always talk about it in association with heart disease and diabetes and everything like that. But there's also been evidence that a Western diet could actually increase the risk for chronic gut disease. And what we mean by that are the two diseases, Crohn's and ulcerative colitis, which are forms of inflammatory bowel disease. So this was actually a multinational study. This wasn't just done in the U.S. And they basically wanted to look at the rates of IBD in association with this Western diet. And by the way, as countries around the world become more Westernized, they start to use these ultra-processed foods. These are the things you're looking for: preservatives, sweeteners, emulsifiers, flavor, trans fat, color, all the things that make food easy to eat and easy to grab and easy to buy. So they did find an association there. So doctor's orders, Savannah, avoid the ultra processed food. We really want people to be eating clean. I always tell people clean, whole food, plant-based if you can, and check your labels, because a lot of that stuff is going to be on the label, and those are no-nos.
Oof. I'm sure they're most of the things that I really enjoy.
That's the problem, isn't it? Yeah. So, Dr. Azar, another thing we want to talk about, Biogen's new Alzheimer drug. It's been in the news a lot lately. Well, it's not FDA approved. It is FDA approved. Not everyone's on board. In fact, some hospital operators are holding off on administering the new drug amid a debate over its effectiveness. What more can you tell us about that?
Right. So just to give you a little bit of a flavor of the controversy surrounding this FDA approval, there have been multiple investigations that have been initiated by congressional committees. Many members of the independent advisory panel who recommended against approval actually resigned after the drug was approved. And think about the price tag, you guys, $56,000 per patient per year. So just let's say there's 6 million people in the U.S. who have Alzheimer's. Maybe 500,000 of them would be eligible for this drug. These would be people with early mild cognitive impairment. Do you know what that is a year? $29 billion for Medicare. So because of that, we've seen some big hospital systems like the Cleveland Clinic, Mount Sinai here in New York City. They're not going to administer the drug based on the cost and based on their assessment of the benefit versus the risk, because there is some risk. There is some brain hemorrhage and swelling that can be associated with this treatment. But look, doctor's orders, remember, if you're a patient or have a family member who has Alzheimer's, it's really indicated only at this point for individuals with mild cognitive impairment, not with people with advanced disease. And look, if the medication is denied, you can always appeal. But I'm telling you, being in this business as long as I have, it'll be a struggle to get this drug approved for very, very many of the patients who may actually eligible. Again, efficacy, debatable.
Right. Yeah. Wow. And a debatable efficacy with a price tag like that is something. All right, Dr. Azar, here's something I'm happy to hear about, because this is the size of my morning coffee. Having that extra cup of coffee in the morning could be good for you. We all want to hear about this, especially on this team of early risers.
Exactly. So in this study, investigators, studied like over 300,000 people for over 3 years, and they wanted to assess the potential risk of caffeine intake with the risk of arrhythmia. We're talking like atrial fibrillation, SVTs, things like that. And this is basically based on studies from decades ago that suggested there was an increased risk in certain individuals. And so for a lot of cardiologists, for example, they'll tell patients who are at risk, limit your caffeine intake. Well, what they actually found that there wasn't an increased risk of these arrhythmias in people who drank coffee. And in fact, each cup of coffee actually lowered the risk by about 3%. And that also we know that coffee in general can be healthy. It can reduce the risk of cancer and diabetes and heart disease and Parkinson's. So doctor's orders, don't be afraid of that cup of coffee, but moderation is key. So what are we talking about? 400 milligrams a day is kind of what the FDA recommends. That's about 4 to 5 cups of coffee. I always caution people, though, it may not be your cup of coffee, Savannah. That doesn't count as one. You have to think about how much caffeine is in there, and those double shot Starbucks drinks, all of that adds up.
All right. We'll drink to that. Also, there were no shots in yours today because the machine wasn't ready. So
yeah, I usually do put a shot in it, and Joe was very sweet and was getting we sometimes switch. The machine wasn't warmed up yet. We're like, okay, it's going to be a great day. Thanks, Dr. Azar.
All right, coming up, billionaire Jeff Bezos, fresh off his history-making venture to space.
What it all means for the future of civilian space travel, up next.
Time now for our CNBC Money Minute, the biggest financial headlines of the day, why they matter to you.
And today we have CNBC's Bertha Coombs with us. Hi, Bertha. Good morning.
Hey, good morning, Joe and Savannah. It seems like after more than a year of being cooped up and watching things on our screens, we're actually going out and maybe talking to people. Netflix reporting its worst slowdown in subscriber growth in 8 years as people emerge from their pandemic cocoons. The streaming giant adding just 1.5 million new customers in the second quarter and is forecasting lower than expected numbers for the third quarter. Basically, they're saying that it's adding a new feature to try to attract new customers, video games. Netflix will add games initially on mobile devices to existing memberships at no extra cost. Square, meantime, is launching banking services for small businesses as it continues to expand beyond digital payments. Square Banking will offer savings and checking accounts as well as existing lending program, which is being renamed Square Loans. The checking accounts will have no minimum balance, overdraft fees, and savings accounts will offer 0.5% annual yield on deposits. Square hopes the new service will be attractive to small businesses who have struggled to gain access to more mainstream banking. And HBO Max is teaming up with Snapchat to bring pilot episodes of some of its shows to the social media platform. With HBO Max Minis, up to 64 people will be able to watch shows together, including Gossip Girl and Game of Thrones. You can chat with everyone while watching and share Bitmoji reactions. You don't need an HBO Max subscription, but the Mini will prompt users to sign up. Now, I know for Savannah, 64 friends is not enough to be able to watch at the same time, but I cannot imagine watching with that many people.
I do have a lot of Snapchat friends, I'm not going to lie.
All right, thank you, Bertha.
Thanks, Bertha. That's very cool, though.
Billionaire Amazon founder Jeff Bezos is facing backlash this morning for a comment made after his historic space flight.
I want to thank every Amazon employee and every Amazon customer because you guys paid for all of this.
That comment drew quite a bit of criticism, including from members of Congress who feel space tourism should be taxed. But the historic spaceflight is also receiving plenty of praise. The entire trip lasted about 10 minutes for Bezos and 3 other crew members on his Blue Origin rocket. The capsule reached about 66 miles above sea level, allowing the crew to be temporarily weightless before parachuting back to Earth.
Former NASA astronaut Mike Massimino joins us now. He's a professor of mechanical engineering at Columbia University and the senior advisor for space programs at the Intrepid Sea, Air and Space Museum. Mike, great to have you with us after such a big day. I guess, first of all, I just want to ask, what was your reaction to this launch, especially knowing that there were no pilots on board? It was an all-civilian crew.
Yeah, Joe and Savannah, thanks for having me. No pilots, totally automated, which I think is actually a good thing. Reusable as well, which I think is another good thing. I think those are the two things that are making the space travel possible for more and more people. And I thought it was a great day, a very successful day, a good day for space flight enthusiasts and people who have interests and dreams of going there someday. And no pilots on board. Just get in and ride and try to enjoy it and do whatever you have to do and come back.
Just get in and ride. Isn't that kind of neat?
That's what it is.
All right. Now, Bezos said that the space flight made him realize how fragile the Earth is. This is something that we hear from people who have been to space before quite a bit. It's known as the overview effect. You've been to space. Tell us what that's like.
Well, Savannah, we know intellectually that the Earth is fragile and that it's beautiful. And we're lucky to be here and we got to take care of it. But when you see it from space, you realize it is more beautiful than words can describe. It's a very emotional experience, seeing your home planet and realizing how beautiful it is. And then the other thing, or one of the other things that you realize is how fragile it is. It's a very fragile paradise that we live in. And from space, you can see the atmosphere. Since you're above it, when you look kind of askew to the Earth and you see the curvature, you can see the thin atmosphere. And it's really thin. And you know it is. And you know it's fragile, but I think seeing is believing. And it makes quite an impression on people and did, of course, it sounds like, on the 4 people that went up there yesterday.
Yeah. And Mike, very quickly, Bezos and Branson have both received some criticism. What do you make of this billionaire space race?
Well, you can criticize, you can look at positive things. I try to remain positive about this. They paid a lot of money to do this. The price has got to come down if they're going to be able to be sustainable. They know that. And I think it is going to open up opportunities for lots of people to go to space. I was lucky enough to be a NASA astronaut. That's not an easy thing to become. It's not for everybody. So now people who want to just go for a little bit of time, whether it's tourism or research, I think they have some hope of going.
Yeah, it is not an easy thing and quite different than civilian astronauts, which is very cool. But Mike, thank you so much for your time this morning. Good to see you and talk about this. Coming up, we're just 2 days out from the start of the Olympic Games in Tokyo, where sport climbing will make its debut.
We'll introduce you to the discipline's youngest competitor, who's, of course, rocking Team USA's colors. Next. Four sports will be making their Olympic debuts at the Tokyo Games: karate, skateboarding, surfing, and sport climbing.
We spoke to Team USA's youngest climber, Colin Duffy. Now, it's a name you might not know yet, but remember that you heard it here first when he's huge very soon. He shared how it feels to be taking his passion to the ultimate level. Here's Simone Boyce.
Sport climbing is making its Olympic debut in Tokyo, and so is Colin Duffy. At age 17, he'll be the youngest competitor in climbing.
I'm just excited. Being so young, there's not really any pressure on me, so I'm just excited to get this experience and just hopefully climb to the best of my abilities.
He never imagined his passion would become an Olympic sport.
In 2016, when it was announced, I was like 12 or 13 years old, so I didn't really have my mind set on the Olympics at all, especially for 2020. So it's pretty crazy now to be able to get to compete, since I had no idea back then.
Colin first started climbing when he was just 4 years old at the local rec center.
I was really mesmerized by the wall and the colorful holds, and just it really caught my attention. So I begged my parents to let me climb the wall, and then that's kind of where my love for the sport first started.
Sport climbing includes 3 disciplines: speed climbing, lead climbing, and bouldering.
All 3 happen on the same day. It's going to be back to back to back, so super taxing on the athletes.
Colin is all about speed.
I'd say speed climbing is pretty much 50-50 mental and physical. Every body movement has to be super precise.
With speed climbing, the route is always the same, and it is fast. Athletes bolt up a 15-meter wall in less than 10 seconds.
The route is used internationally, like it's a set course that's been used for years now. So every time you get on the speed wall, it's the exact same route. So people have been able to put up phenomenal times just by training on the wall every day.
For lead climbing and bouldering, the courses are random.
For each comp, anything is different with climbing. So that's what makes the sport so unique. Every time you're on the wall, it's different sequences, different holds, something you've never seen before. So you really have to be able to make quick decisions and really have good route reading.
Colin has taken the last year in stride.
I think for me, it was a really good thing because I've had a full year now to really grow and improve, especially being such a young athlete.
He's also taken advantage of the extra training time.
And obviously the postponement was the best option for everyone's health and safety. So I think it was a win-win situation for me.
And now Olympic gold could be at his fingertips.
This is a tricky last move. There's an Olympic slot depending on this. Colin Duffy's done it.
It means the world to me, and I'm honored to get the opportunity to compete. And hopefully the rest of the world loves the sport and it can continue to be in the Olympics in the future.
Add that to the long list of sports I can't do.
Oh, yeah, for sure.
That does it for this hour of Morning News Now.
But the news continues right now.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.